we're working with hamsters with CoV-2, and I work with Jeff Hogan at UGA, who also works with Ted Ross. And so we're actually, so Ted and Jeff and I are involved in a number of different studies. So we're working on therapeutics at the moment, but and there's actually some work being done with Jim Crow at Vanderbilt also. So there's a whole group of us that are interacting on CoV-2 and specifically in hamsters. So I wanted to make sure that Jeff was given credit, because I'm going to show some of the data that we've generated at least. So, I mean, most of you are probably familiar with the fact that hamsters have been used actually as models for infectious agents for some time. And I specifically added this paper that was published last year in Frontiers in Immunology, just because it's actually a really good reference for finding antibodies against host proteins, because you could spend a lot of time trying to find good sources for antibodies, and they actually did a nice job of summarizing that. But hamsters have been used for some time for models for paramyxoviruses, flaviviruses, and somewhat for filoviruses that have been adapted specifically to hamsters. And there was some SARS work also done in hamsters in the early 2000s too. So I would say that, you know, in general, they have been useful models. I've seen them used for vaccines in addition to treatment. So they have been used, I would say. More recently, there have been obviously a slew of papers have come out this year, specifically regarding them as a model for CoV-2. And I thought I'd just summarize some of the findings that people have come to. So there have been males and females used in studies. Animals ranging from in age from 4 to 10 weeks to about 7 to 8 months actually have been used, even though I would say more commonly it's in that 4 to 10 week period. And I can tell you, at least from our experience, why that is, because we've been using the 3 to 4 week old males. And the reason for that is that you want the younger animals, at least, they eat a lot, and so they gain weight really fast, actually. And so just you need to keep that in mind. So depending on what you're doing with them, they're and you'll see data from folks where the uninfected or the animals that have been given you know, just a vehicle and many, or haven't been given the virus, actually, that curve will, they get bigger. And so they keep eating. Anyway, the other issue is males versus females. And I would say from our experience, you want males just because the females tend to have a lot of issues with fighting. And so, matter of fact, I think Ted Ross ran into that issue, not knowing how they would interact. So we've stuck with mostly males. And so, and again, route of administration for COVID-2 has been predominantly intranasal. There was one study from Quokka's lab where they looked at intraocular in addition, but in general, most of the studies are intranasal. Amounts of virus vary, but I would say between 10 to the third and 10 to the sixth PFUs, and we'll talk about some of the differences that folks have seen. So far, neither the high dose nor a low dose will cause death in wild type hamsters, and we've seen the same thing. There are obviously increases in weight loss when you go to the higher dose, but they do recover. Weight loss can vary between 5 and 10% for lower doses, say 10 to the third. When you get to 10 to the sixth, you'll see 10 to 20% over usually the first 5 days, and then they'll recover. What you do get though is I would say high titers. You know, if you put 10 to the third in, you're going to get titers that can be almost 10 to the eighth in some cases. It does vary though, depending on from lab to lab. But I would say, and you see, replication in nasal turbinates, trachea, and the lungs. Again, it'll peak usually by day 3. It'll come down maybe a log or so, and by day 5, and then by day 7, you'll see a pretty significant drop off in titer. What you don't see, interestingly enough, is sometimes you'll see persistence of viral RNA. And so, and I think that, you know, there've been, in general, you'll see very high copy number of viral RNA. Now, most people are looking at the nucleocapsid. And so you're getting both obviously genomic and subgenomic RNA. So the levels can be very high as 10 to the 10th in some cases. And again, that usually peaks around day 2, but it'll only decrease maybe a log or 2 even over 7 days. So you can still see a lot of viral RNA around, though the actual viral titers will drop off, and that's been seen in a number of different studies. So it's certainly been replicated a number of times. I thought one of the, I think really one of the more interesting papers was by, again, from Kawoka's lab, where they looked at micro CT. And as far as I know, they were the only lab that's looked at CT in hamsters. And they, I think what was really neat about this is this really helps in terms of trying to understand why they're a good model, because if you combine this with the histology and again with the replication, you really get a good picture, I think, of what's happening. And they showed that there are CT lung anomalies really as quick as 2 days post-infection. So it is it's certainly accelerated over people, but just the same, you will get CT lung abnormalities. You'll get patchy ground glass opacity. As it progresses, it gets more severe. This will continue. They'll see more of that actually in different regions of the lung, and you'll start to see consolidation. And I'll show you a few pictures of lungs at day 3 that we've seen. And certainly there's a lot of lung damage. What was interesting is that in the most severe cases, you'll see they actually saw it a little bit later, actually 7 days out of day 7, which is interesting because we haven't pulled a lot of lungs out of day 7 as of yet, but I know we're in the process of doing so. But it was interesting that the titers are pretty much gone, by, very, very low by day 7. But at the same time, again, of course, you're seeing still a lot of damage, which again, I think is quite interesting and similar in some cases to people. Again, the high dose animals do have more severe lung abnormalities, but I think it's not that much higher, but they did score them. In addition to that, I think, again, I think by 8, you'll see pneumomediastinum actually out at 4 days or so, which I think is also important. Again, you will see severe pulmonary damage, micropulmonary rupture, and again, gas trafficking. So a lot of the problems that you'll see in people later on, you do see in this model, which I think is important. So I think overall, now one other thing that's interesting is that a lot of the remodeling, even when they recover, is still there. And I think that's also quite interesting to keep in mind, because there are certainly some folks that will have sort of, it take them a long time to recover, even though most of the pathology is recovered, they're still suffering in terms of lung function. So I think you do see some of that's recapitulated in this model. Histopathology, most severe lung lesions are at day 3. A lot of them will resolve again late, but I would say one thing that was interesting is that even by day 6, you can't really tell the difference between the high and low doses. And again, the viral RNA levels show this. You do see some difference in titer though, but certainly the lung scores, at least regarding histology, are pretty similar. And again, a lot of inflammation. You can see focal inflammatory cell infiltration. So that's important. It is recapitulating that. Viral antigen positive cells, easy enough to find. I would say certainly, by day 3 to day 6 without too much difficulty. Again, by day 10, it's quite a bit better. Okay, make sure I know where I am. And I thought I would just mention a couple of other models. So that was all for wild type hamsters. And there have been, there's a group at USAMRIID that also used immunosuppressed, whoops, I think I skipped a slide. Whoops. Oh yeah, okay. So they've used immunosuppressed models in hamsters. There's a paper published in Journal of Virology. So they used cyclophosphamide to basically induce transient partial immunosuppression. And I think it's a little, the time course is quite different. It's much longer. They actually continued to inject them with cyclophosphamide out to about day 21, and then they stopped, and you can see what happens to the weight. So there's a progression of weight change down past 7 days or so, and then they kind of flatten out, and then eventually they do recover as they've taken them off of the cyclophosphamide. But it's a 35-day course versus, say, a couple of weeks. So it's considerably longer when they're immunosuppressed. Again, viral RNA levels are quite high, and really I don't think you really see a big difference in terms of viral RNA levels with dose, at least in this particular model. And so I just wanted to mention that. I think there was also the RAG2 knockouts, and Adolfo mentioned knockouts in hamsters. They also report this model. So they have no functional B or T cells. And this is lethal model. So the median day to death is about 6 days when they were infected IN with about 10 to the fourth PFUs. And so replication is mostly lung, trachea, so pretty similar, but it definitely is lethal. And so just keep that in mind. If you're looking for a lethal model, this would recapitulate that. So in terms of, what do you see in hamsters overall? There are some clinical signs. We see ruffled fur and rapid breathing. We've seen that too. Weight loss, really quite rapid, day 1 to day 2, but recovery by essentially in 2 weeks. I do think that's kind of similar to what happens in humans sometimes. I mean, it's similar-ish. Again, replication, nasal turbinates, trachea, lung, definitely. There has been a couple of reports of minor replication in the intestine, so take that for what it's worth. Certainly severe pathology that resolves by day 10. So how is it similar? I think the time course duration is similar to most people, but not all. Certainly viral replication in the lung, focal and inflammatory cell infiltration is important. Edema, alveolar hemorrhage, is quite similar. There has been reports of transmission by both direct contact and aerosol. And I think where you don't have, where it is different is that certainly in most people, in 80% of folks, most of the replications in the upper respiratory tract, and you don't get that in this model. So that's where maybe the ferret might be a bit better. In this case, you consistently get replication in the lung. And I just thought I'd include in this deck some of the data so you get an idea of what the weight loss really looks like. So this is pretty common. This is pretty, I would say, pretty common. I'll show you some of our data too. But one thing that's interesting is that even in this study, they actually looked at 1 month old hamsters and much older 7 to 8 month old hamsters. There was some differences in titer, but I wouldn't say it was very large. So that's something to keep in mind. Matter of fact, the titer profiles are pretty similar both at the low and high dose of virus. And so I thought that was interesting. In this case, I wouldn't say you see, and if you look at weight loss, though the older ones don't seem to eat as much as the young ones, in general, the degree or the magnitude of weight loss is pretty similar, really. So I don't know if older hamsters help you out that much in general. I did want to include this, and certainly, I think the CT scores were really interesting. I think seeing the severity at day 8, which is much later than when we, it really post the titers have come down by day 7, and at the same time you really see all of the damage in the lung and and you can pick that up on a CT. And I thought that this was really a novel part of this study. And again, lots of pathology and certainly pathological scoring. And the high doses do tend to be a little higher, as I said, but not, I wouldn't say not all the time. At day 6, they're almost the same. It's really only at the early time points where you see differences in pathology. And probably I'll skip some of this. There has been a transmission study, but I included some of this. And this is just some of our own data. So this is work with Jeff Hogan. We did both infections with by intranasal and by a microsprayer. So we did some intratracheal spraying of the virus too. And our data is actually pretty similar. So we did both 10 to the 3rd and 10 to the 5th PFUs. And so as you can see, there is a difference in weight loss, a little bit between them. In general, obviously the microsprayer does seem to, I would say, exacerbate it slightly, but I wouldn't say it's a huge amount. So, but there are certainly differences in the profiles. But in general, it's following a lot what you see in other folks. We haven't taken it out to 2 weeks, but I'm sure they're all heading in that same direction here. And again, similar in terms of titer. We were seeing, and you don't see, just like other folks saw, you didn't see a big difference even there's some difference in titer, but not huge when you use different amounts of virus. That seems to be pretty similar. And again, peaking at day 3, coming down day 4, day 5, and by day 7, pretty low. This is the same thing what we saw here. Some differences between the microsprayer and intranasal, but I wouldn't say it was huge. They have very similar trends. Certainly a lot of hemorrhaging in these animals. So even at day 3, it's really quite bad. So if you are looking for lung damage, you will find it in these animals consistently. And I would say in life measurements, you guys asked about that body weight. You can do nasal washes, and I do think non-invasive imaging is kind of neat and quite interesting to use in these in evaluating them if you have access to them. Post-mortem, it's been mostly titer, viral RNA levels, and then histopathology in general. So that's pretty much what I had.